this point, we really never know when it's happening, but on my other screen, it says that we're not live yet. So we just wait a minute. And
I
then
got I got a little message that says this meeting is being live streamed. So
I,
maybe.
I know. Okay. I think we're live. This is so exciting. Hi, everyone. This is Dr. Gardella, and I am here from BChip with Samantha. Samantha, welcome. You haven't done a call.
No, I haven't. This is really exciting. I'm nervous and excited.
We're really painless here. So why don't you first tell us what you do for BChip?
Yeah, so I'm Samantha. I am the program coordinator here at BChip. I kind of have my foot in kind of a little bit in everyone's programs, but the three that I mainly focus on are smoking cessation, our PA Navigate, formerly known as Find Help, but I'll explain that in
Right.
a bit, and our family planning navigation program.
Okay, so we're going to talk about smoking cessation and PA Navigate. Let's give smoking cessation a whirl first. So if anyone wants to stop smoking, first, how do they contact your team? And then what's the program that you guys offer?
Absolutely. So I actually think we did a video with one of our wonderful facilitators,
Oh,
Caroline,
yeah.
who gave you a little bit of a background, about smoking. But for anybody who is ready and willing to come to these classes, they can call BChip, so they can call our main number or they can call me directly, and you can get that from a multitude of places. So our social media pages, you can go to our website, which is www.bchip.org, and you can register online. Or if you go to any Bucks County hospital, really, if you go to if you go to St. Mary, if you go to Jefferson Bucks, Lower Bucks, what's the other one? Grandview and St. Luke's. A lot of the times we actually do those programs inside of their hospitals. So if you were to reach out to a doctor and say, I'm looking to stop smoking, they more than likely already have that information and they can, refer you to us so you can get our information from them, or they'll, ask for your information and pass it on to me. Either way, you'll get in contact with me one way or another. But all of our classes are both virtual and in person. So virtual is usually for any folks who can't make it out to the classes. Our classes are in the evening, so I know especially in the winter time that might be a little hard for some folks. So we do offer virtual, and if not, we do have the in person at all of our Bucks County hospitals.
Okay, so they can go in person or they can sit on a Zoom call, basically, right,
Yep.
with you guys. And
Mhm.
how long are the programs usually?
They are 5-week sessions. So if you sign up for a Tuesday night class, you'll go every Tuesday night for 5 weeks. You are more than welcome to sign back up for another class if you feel that you need it. The program is completely free. We offer nicotine replacement therapy. We call it NRT, and that's another perk of joining the program, and that's also completely free. So it's no charge to you to do anything in this program.
Great. And for those not in the business, nicotine replacement therapy is gum, right?
Oh yeah, absolutely. Sorry. Yep.
No, not at all.
We speak in acronyms here a lot, but yes, it's the gum, the patches, and the
Oh,
lozenges that we provide for free. So if it's an in-person class, you get it, there in real time. If it's virtual, we mail that out to you. So again, there's nothing on their end that they have to do other than, be ready to commit to this journey and just joining our class, with a positive, attitude.
sure. So you get the support that you need. You have a coach that's running the sessions. Do you get coaching between sessions?
So so we have four wonderful facilitators, one of which everybody has met already, Caroline. Everyone has a bit of different teaching styles, so it's really a matter of also finding, your person, your facilitator that you really get along with. And
Sure.
then yes, so you have the class. It's about an hour and a half. It's from 6 to 7:30, and the majority of the time, the facilitators have the contact information of everybody in the class. And I have heard more times than one where they are having phone calls just outside of class if they ever need that support. They text them sometimes. Even members of the class, because it is a group session, they even come together on their own separately, and they just kind of have meeting times where people in the class get together and they talk things through, or if they need that support. So I've seen that happen many times, and it's absolutely encouraged.
Awesome. And I think the trick also is that you just don't get 5 weeks and then you're dumped, right? You can continually sign up because the rate of, well, people sometimes, slip up. and they want to come back to the program, and that's okay because then the BChIP program is always there for you.
Absolutely. I have people who have been taking our program for years on and off, and maybe just recently they started to take it seriously and say, you know what, I am ready. A lot of the times people come and they think they are, and they join these classes and they kind of realize, I'm not there yet, and they might drop out. They might stay the whole way through, and then maybe towards the end they feel that they are. Everyone's in different places in terms of this journey, so I always tell everybody that it's a really no pressure situation here. If you're not ready, let me know. I've had a couple people who, they sign up and then maybe a week or two later they call me and they say, I'm not there yet. I'll reach back out. So it's whatever, everyone's feeling. Sorry about that.
Yeah, and also it's a hard habit to kick, and you can't just be expected to do it in 5 weeks. It can take a lot longer. So it's completely
Absolutely.
reasonable. It's an awesome part of the program, the support and the fact that you can just keep doing it.
Yep.
I think it's great. Okay, so one of the other sides then of the work that you do is PA Navigate. So there's two pieces to PA Navigate, which I love. There's people can go in there directly, but there's also the ability for service providers to contact other service providers. So why don't you go ahead and explain what it is and the types of services that are there?
Absolutely. So PA Navigate was formerly known as findhelp.org.
Right.
And it still is. Find Help is actually also the name of the organization that we've been working with. But the state of Pennsylvania actually is getting involved, and they want to rename it for something that all Pennsylvanians can, I guess when they hear the name, they know that it's like a PA resource that they can go to. So it's now called PA Navigate. You can still access findhelp.org, and it's going to take you to the exact same thing, but we are now promoting PA Navigate to just kind of align ourselves with the state. It's a website. I like to tell people it's like the yellow pages, but online. So you go online to panavigate.org. It's going to ask you to put in your zip code. So you can put in your zip code. This works across the United States, so it's not just Bucks County. So if you have family or friends in another state, they are more than welcome to use this website as well. So after you put in the zip code, you can search for a multitude of things, and that's, housing, transportation, medical, legal, food, whatever it is that you're looking for. And PA Navigate is going to give you all of the free or reduced cost programs. So you're never going to get programs that are charging you, a full amount. It's all free or reduced cost. A lot of the times it's going to have the eligibility criteria, so you can even look for yourself and say, am I eligible for this? If there's a wait list for some programs, it'll let you know on there too. So that's a really great tool for the public to use. It's free to use. Anybody can log on and use it. It's going to give you all the contact information you're going to need. And then for service providers, what we're trying to do right now is implement it into the hospital's EMR systems. So, when you're being discharged, or if you bring up an issue to your doctor or nurse, they have a resource that they can go on and send you on your way. So if somebody goes to the doctor and they say, I'd like to stop smoking, they can go on PA Navigate and, search smoking cessation or stop smoking classes. And if you're in the Bucks County area, BChIP will pop up, and they can either put in a referral themselves through
Right.
the website, or they can just let them know, hey, here's the phone number, reach out to them, and they'll get you some help. So that's one of the pieces that we're trying to do, is get them into the hospitals, and even just caseworkers, anybody who can
Right.
benefit from this. It's a great tool. It's free to use. It's easy. We can provide training for anybody who does not know how to use it, or they just want to have a little bit more information. We can train them. Organization can claim their program on PA Navigate and make changes as needed. So if a new program pops up and they need to add it, if they have it claimed, they can, add all that new information. If their hours have changed, if their location, their phone number, anything has changed, they can go online and make those changes themselves in real time. After they've claimed. And again, in the training, we'll show you how to do that too. So really, this is open for anybody who is interested.
Yeah, and I think the important part is to know, well, that for both groups, right? The service providers, so caseworkers, social workers, doctors, And also for individual clients, there's services available. And sometimes we all need help in some way. So if your family doesn't have a place to live, if there's not enough money to afford food right now, if you need healthcare or you need healthcare insurance, it's whatever your issue is, there is a entire database of knowledge for you out there to help cut through the red tape and where, Google search is a nightmare, like, and it's just there for you to help out, right, to
Yeah.
get help.
Absolutely. And then even for those folks who maybe don't have a phone or access to internet, if you see our postcards, we have our VlsItrp contact information on there, and that's because you can give us a call. So if you don't have any, you know that you can use this resource, but you have no way of using it, getting online and going to PA Navigate, you can always give us a call and say, hi, I'm looking for, food pantries in my area. I don't know where they are.
Right.
I don't know how to look for them. And then we're just going to go ahead and collect that information. Say, okay, well, what's your zip code? And I'll look at some food pantries for you and send you on your way with some, addresses or phone numbers that you can call and contact. So that's also another option for folks who just don't have access to those things as well.
Absolutely fantastic. So let's tell people how to get in touch with you, Samantha.
Absolutely. So you can either send me an email. So it's sherrera, SHERRERA at vchip.org, or you can call my direct line, which is 267-291-7879.
Awesome. You are natural.
Yeah, this is it's my spiel that I do when I talk to folks and do that, initial intake. So you'll hear that a million times if you give me a call, but yeah.
Yeah, that was great. Okay, everyone. So have a great holiday weekend. Thank you for being here. Again, if you need to stop smoking or you need some service support for you and your family members, reach out to the resources. I'll link them under the video on Facebook when this is processed later. And there's services available for you. So you are not alone out there. Okay, we're going to stop the live now.